And welcome to Community Pulse, a public affairs show about public health and wellness in Chicago. My name is Levi Moore. I'm one of the three rotating co-hosts of Community Pulse. And well, show's a little bit different. Normally I'm in the studio, but people are really busy. And the other thing is, I realized in the 2.5 years I've been doing this show, I've always worn a suit or a sport coat. But because of our guest today, this show is going to run in August, which is Free and Charitable Clinics Month. So I am wearing my IFCC shirt. As you know, I'm a proud board member of the IFCC. And I was trying to think who would be a good guest. And it was painfully obvious. The new dynamic rock star Executive Director of the IFCC, Laura Starr. Laura, welcome to Community Pulse.
Thanks for having me, Levi. I appreciate the generous introduction, and I am also really grateful to have you on my board and that we get to work together so closely now.
This was great. So, hey, before we get into all things clinics, all things IFCC, give us the Laura Starr mini biography. Who are you? Where are you from? Da, 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 da.
Sure. So I grew up in Indianapolis, but moved to Chicago in 1999. So I've been in Chicago longer than I lived in Indiana. So I claim Chicago now. But I have spent my entire career in the nonprofit sector in a lot of different types of organizations and in some consulting early on. But about 13 years ago, I found my way into the free and charitable clinic sector through Community Health, which is actually the largest free health center in the entire US, and it's located in Chicago. And have absolutely loved being part of the sector and was super excited to have the opportunity to join IAFCC last December.
Okay, and I'll let you all know it was really kind of funny that I tell the story. Laura switched jobs, but she didn't switch bosses.
Yeah.
Because the
Yeah,
chair of the IFCC is your old boss at Community Health, Steph Wilding.
that's right. She's the CEO of Community Health.
Yeah. So before we get, this is something that we've had problems with a few years ago when we were, trying to get an appropriation from the General Assembly. Let our guests know, okay, what is a free and charitable clinic? How is it different from other clinics, from FQHCs?
Yep. So a lot of people in Chicago, especially, are familiar with Howard Brown, with Esperanza Health Centers, with Erie Family Health Centers, with so many of the federally qualified health centers that are doing tremendous work throughout our city. But what makes free and charitable clinics a little bit different is how we pay for the care. So, free and charitable clinics are supported by donations and largely by volunteers. Often the doctors, nurses, all the healthcare providers, and sometimes even the administrators making sure that people get access to care in a free or charitable clinic are volunteers themselves. They're volunteering their time, and the care in our clinics, just like the FQHCs, is provided at a deeply discounted rate or completely free. The clinics that do charge fees have sliding scales that go all the way down to zero, and we will make sure that people get access to the care that they need. The other thing that I'll throw in there, in addition to how we pay for our care, is that free and charitable clinics are very, very different from one another. So while federally qualified health centers have federal contracts, they have specific mandates that require that they do things in a certain way, that tends to be similar from clinic to clinic. In free and charitable clinics, because we are not constrained by
Mhm.
any mandates or contracts, our clinics are built specifically for whatever the community is that they serve. So, what that means is they are completely different from clinic to clinic. There is one clinic who they just do mobile vision screening, particularly targeting formerly incarcerated individuals who are looking for jobs. There's another clinic who just does dental care inside homeless shelters. Every single one is very specific to the community that it serves and built really in a really customized way for that community.
But one of the things I always like, well, it threw me. I was talking to a legislator, and it said, "Oh well, what do you mean the night ministry? That's not a free clinic." It's like,
Yeah.
yeah, the
Yep.
night ministry is like, and they said, I always thought they just provided, homeless services. Like, and I kind of reiterated what you said. It's like each clinic is a little bit different.
Yep.
Yeah. So, give us like, the landscape of clinics. How many are there? Where are some of them?
Yeah. So we have 46 clinics now in the state of Illinois who are members of IAFCC. So that's a dramatic growth. Last year we were at 37. So that's almost a 25% increase, if I did the math right, there in just a year's time. So we're growing really dramatically. About a little over half of those clinics are in Chicago and the surrounding communities, because that's where most of the people are. But we also have clinics spread throughout the entire state, all the way down to Collinsville, Peoria, and even a new clinic that is coming up in Carbondale. So we're spreading our wings throughout the state to make sure that wherever people live, they have access to care that they can afford.
Well, as you know, I was maybe more than anybody on the board. I was ecstatic when the Carbondale was coming online because
Yeah,
I'm from East St. Louis, the Metro East, and I always would point out to people that no, Springfield and Peoria are not Southern Illinois.
right.
There's geographically another third of the state below that.
That's right.
Well, hey, you've been on the job. What did you start? You started in January, I think.
I started in December, so 8 months next week, I think.
Okay. What has surprised you about the job? And although I'll probably apply this with because a lot of the board members, a lot of us have worked with Laura. A little thing when we were deliberating said, hit me said, out of all the candidates out there, the one that had hit the ground running fastest is Laura. But things know it's be a little bit different, when you get into the job. So what has
Sure.
surprised you?
What has really surprised me is how isolated some of the clinic leaders have been. It is really, really easy to get tunnel vision. You're so dug in to providing
Mhm,
the care that your patients need, serving the people right in front of you,
mhm.
and often not having an opportunity to talk to others who are facing some of the similar challenges. So that's been it's been surprising, but it's also been a real joy for me is to find those moments of convening the clinic leaders together and finding more and more opportunities to let them share their stories, let them share their challenges with each other. And a perfect example is you mentioned the night ministry before.
Mm.
You and I were in a committee meeting recently where one of the leaders from the night ministry was sharing a specific challenge that they were having in their clinic. And the immediate response in that meeting was for other clinic leaders to jump in and start asking questions about how can we support you? How can we jump in and do something differently? And that's one thing that I think is so cool about our sector is that we're unconstrained to really get creative, really come up with innovative solutions just to meet every single moment as it comes along. And that when we do it together, collectively, as an association and as all the clinics working together, it's just so powerful.
But there's been a lot of turnover in terms of clinic leadership. And just an example, I remember when Steph Wilding was considered one of the new leads,
Yeah.
and now she's one of the veteran leads of running a clinic. It's just in like a 4-year period. Yeah, so and just like everything, I always look at life a lot of times as pre and post pandemic, and there were so in healthcare, especially, there were so many retirements, so many people that just got overwhelmed, and so there's just been this huge flip of new leadership, and you know what? It's not a bad thing.
Yeah. Steph started at community health 90 days before the COVID pandemic. So we've all lived several lifetimes since then. Between the pandemic and in Chicago, healthcare responding to the migrant crisis and immigration enforcement
Yeah.
because we serve such a large immigrant population in our clinics. It's been a lot. A lot has happened in the last
Mhm.
7 years.
Oh yeah, yeah. Hey, challenges. What challenges have you had? And we're gonna split it up too, whichever you want. Challenges as an association, and then what challenges have you seen that the clinics are having?
Sure. I think I kind of alluded to how busy and laser focused the clinics are, and that comes out in a number of ways. Even right now, as an association, we are in the process of gathering data from all of the clinics, and we need to be able to aggregate that data to report out about the sector, but also to give them feedback about their performances. We do scores on health equity and all sorts of things, and there is tremendous variation between the clinics in the way that they capture data, the way that they report their data. Trying to compare one to one to one is
Yeah,
literally apples and oranges. Maybe not literally, but figuratively, apples and oranges. They are all very different. And so putting those pieces together is hard to get to the point where we can see one big global picture. But I think that is only going to get more and more challenging because, from the clinic perspective, demand continues to surge. So, I am trying as an association to arm them with as many resources
hmm,
as we can because we're looking at an estimated 500,000 people who had health insurance in 2025 who are not in the state of Illinois, who are not going to have health insurance by end of 2027. 500,000 more people who could utilize services like at our free and charitable clinics, and we don't have that capacity to take care of everyone. We are uniquely positioned to care for that population. They are not unfunded to us the same way they are if they show up in an emergency room or if even in a federally qualified health center. We can care for those individuals. We want to care for those individuals, but we don't have the capacity because so many clinics are staffed by volunteers, very understaffed, just cannot take the influx that's coming. And so I'm trying to take all of this information that we're collecting and figure out what are all of the tools that we can put in their hands to make them better able to increase capacity.
yeah. For the viewers, a little inside baseball. I don't know. I have been curious as like, well, during the Border Patrol ICE raid,
Hmm.
I don't know. Um, a lot of free clinics serve a lot of undocumented people,
Yes.
but then out of concern, out of fear, out of caution, those people stop coming to their appointment. And so I was always wondering, man, I wonder what the clinic patient visits are going to look like. And then something I never would have thought about. And I think it was Susan Hoban that posted this on LinkedIn the first time I saw it. And it was about how these people that had either lost their ACA benefits or could not afford their ACA credits discovered they could go to a free clinic.
Yeah.
And now they have more people than ever. And I'm like,
Hmm.
wow. So I mean, that's been the story I've been telling people. I literally told that story yesterday. I was doing an interview. There was this project that UIC and Health and Medicine Policy Research Group is doing for the Volcker Foundation. It's about
Hmm.
health networks and Hospital Alliance is considered a health network. And they're like, what impact have some of the federal decisions had on your members? And I specifically cited that. I said that those changes really have the clinics bursting at the seams. And then I also added in and said, oh, and don't get me started on SNAP benefits.
Yeah.
Because
Yeah.
that, yeah,
And that was just the tip of the iceberg. So the end of last year, when the premium tax credits expired for everybody buying their health insurance through the marketplace for themselves, that's what you're talking about, and what happened up at Family Health Partnership, and that's happening at a lot of clinics, is that 92,000 people in the state of Illinois did not purchase marketplace insurance because of the premium tax credit expiration. So, and that's just the tip. That's just
yeah,
the tip of
yeah,
the iceberg.
yeah. That is well, it's rubber hitting the road. Like, okay,
Yeah.
you made this decision, and this what happened. Um, hey, I don't want to forget this. August is free and charitable clinics month. So
That's great.
what's going on? What are you doing? What's some things that are happening?
There is so much happening during Free and Charitable Clinics Month. I would strongly encourage people go to our website, illinoisfreeclinics.org, look at the clinic directory there, and find the one that's closest to you. I guarantee they are doing something fun for Free and Charitable Clinics Month. And some clinics are doing back to school health fairs. Another clinic, the Night Ministry, which you mentioned before, is doing a panel discussion on August 11th. There are just all sorts of different things happening in every community. In fact, we give out grants at IAFCC to clinics who are hosting events for Free and Charitable Clinics Month, and we got 29 applications this year, which is the most we've ever had, which means 29 different things are happening at 29 different clinics, and they are all doing incredible work. And we'll also be throughout the month highlighting on our social media accounts clinics and cool things that are happening in all of them. So stay tuned, follow us on social media so that we can get the news out about every single exciting event that's happening.
Okay, I want to switch gears a little bit. Okay,
Okay.
I've been chair of the advocacy committee for well, a long time. When I've always wanted us to be more involved on the policy side. And so the IFCC recently issued a press release. So could you talk a bit about that?
Sure. So a new regulation was just published earlier in July about public charge rule. And what public charge rule is, it's a determination that is used by the federal government as they're assessing somebody's application for a green card or a visa into the United States. And what has happened in the past, the previous rule said that you could be refused a green card, for example, on the basis of public charge if you had been through some sort of long-term institutionalization that the government had paid for, or if you received cash assistance of some kind from the US government. Those were the only two categories. Now, this new regulation that just came out allows the immigration officers wide discretion to look at basically any interaction with the government that is means tested. So that means if your kid, not even you yourself, if your
Mm.
child is in a public school and gets free lunches, that could be used against you in consideration of whether or not you become a legal permanent resident in the United States. So that's just one example of many, and it has a really dramatic chilling effect on the immigrant population and their willingness to engage in benefits which they are entitled to. We don't want children not getting lunch at their schools. We want them to be able to access those benefits if they are entitled to a Section 8 housing voucher to get subsidized housing, things like that. We want those families to be able to get the resources they need while they're going through the immigration process and paying taxes and being contributing members of society. And we're very concerned about the impact that that's going to have on the health of the population if they're not getting access to those benefits.
Yeah, I know, but a lot of people don't think about is that these people are paying federal, local taxes,
Right.
sales tax, rent. They're purchasing goods in stores. They're vibrant parts of the important parts of the economy, and it can take 10, 20 years to go from seeking green card to finally getting becoming a citizen.
Yeah.
So, boy, know a lot of people in my life who have not kept their noses clean for 2 decades. um, yeah. Um, so hey, we're nearing time. We have a little bit more time. Um, put on your vision is futuristic glass. Uh, where, how do you perceive the IFCC? What will it look like in 2030?
2030, it's a little scary knowing how much things have changed in the last 4 years to predict what's going to happen 4 years from now. But my hope is that we will have such a strong coalition where all our members are talking to each other on a regular cadence. Their IAFCC is increasing the funding that we're able to distribute to the clinics, but we're also increasing the resources in terms of education programs and conferences and convenings where we can bring them together. And we really truly have built a network that functions like a network. They can even refer patients to each other if they don't have the capacity in one location, but somebody else does, or they don't have a specialty service. That's really what I hope for the future of our network.
Okay, I'll do a little commercial. What Laura was hinting at was like we get an appropriation from the state of Illinois every year. Thank you. And if you want to know a little bit more about that or what happened in Springfield during the budget session regarding healthcare, look at the previous episode of Community Pulse on YouTube, where I actually interviewed the IFCC Springfield lobbyists, Debbie Broadfield and Christian Rebelke. Um, Laura, it has been a pleasure talking to you today. And I'm sure I will see you. We probably have a meeting sometime soon. So, but appreciate your coming on. And
Always a pleasure, Levi. Thank you.
okay, and to the our producer at Can TV, thank you. And once again, my name is Levi Moore, one of the rotating co-hosts of Community Pulse. And well, I'll see you later.